Hi, good evening everyone. Welcome to my presentation. So today again I am back with some important MCQ in child health nursing. Here you can see the first question. Child participating in decision making process about health is termed as. Child participating in decision making process about health is termed as. The answer is assent. So if adult participating in decision making process about healthcare, so all we know that is consent. If you are taking permission or agreement before healthcare from the children, that we can call assent. Or if you are taking permission from adult before starting healthcare or any procedure, so that we can call consent form. Then next, second question you can see. The major cause of childhood illness is. The major cause of childhood illness is. The answer is malnutrition. And here you can see, according to the children magnitude, major health problem. Here we have the order. The major health problems are low birth weight, malnutrition, infection, parasitic infestation, accident and poisoning, and behavioral disorder. Then in that, the major cause of childhood illness is malnutrition. Then next question. The modern concept of pediatric is. The modern concept of pediatric is, it is a continuous preventive care of whole child. Then next question. The hospital procedure for child are. The hospital procedures for child are the same in principle as those for the adults. The principle, so whatever we are using before giving any procedure, the same principle we are using during child care. So there is no change in principles between care of adult and child care. And next, fifth question. Minimum area provided to an infant in hospital. Minimum area provided to an infant in hospital is, the answer is 400 square feet or 440 meters square. Then next question. Which is the best shape for the pediatric ward? Which is the best shape for the pediatric ward? The answer is square. Square is the best shape for the pediatric ward. Optimum temperature of pediatric ward. Optimum temperature of pediatric ward. The answer is 28 degrees Celsius. 28 degrees Celsius is the optimum temperature of pediatric ward. The next question. Who is the father of pediatric? And the answer is Abraham Jacob. Abraham Jacob was the father of pediatrics. Then congenital means. Congenital means, and the answer is disorder present at birth. Disorder present at birth, so that we can call congenital disorders. The next, hereditary means. Hereditary means, here a disorder pertaining to the genetic characteristic and transmitted from parent to offspring. If the disorder transmitting from parent to offspring, and that disorders we can call hereditary disorders. The next, Marfan syndrome. What is mean by Marfan syndrome? The answer is, it is a hereditary degenerative disorder of connective tissue. Example, eye, blood vessels, bones, muscles and ligaments. Then, all are congenital disorders of newborn except. The answer is meningitis. Meningitis is not a congenital disorder, it is an infection. Actually, you can see common congenital disorders in newborn, that is hydrocephalus, tracheoesophageal fistula, spina bifida. But meningitis is not a congenital disorder. So meningitis we can call it is an infectional disorder. The next, which hereditary disease is most closely linked to aneurysm? Which hereditary disease is most closely linked to aneurysm? The answer is Marfan syndrome. The answer is Marfan's syndrome. So here you can see the some characteristics of this Marfan syndrome. So here the child who has this Marfan syndrome, we can characterized by tall, lean body with long extremities, pectus, carinatum or excavatum, or aortic aneurysm or aortic dissection, abnormal joint flexibility, flat feet and scoliosis. So these are the characteristics you can see in the child who has this Marfan syndrome. Then pectus carinatum also called. So this is in picture you can see pectus carinatum is also called pigeon chest. Then pectus excavatum also called, and the answer is can also called funnel chest, sunken chest, hollowed chest or cobbler's chest. Then all are hereditary disorders except, and the answer is cystitis. And the common hereditary disorders are thalassemia, hemophilia, cystic fibrosis. In that, cystic fibrosis is not a hereditary disorder, but this thalassemia, hemophilia we can call hereditary disorders. Then a couple has 2-year-old child with cystic fibrosis. When planning their next pregnancy, the couple should undergo. Here what is the problem? The couple has the 2-year-old and the child has the problem cystic fibrosis, and now they are planning for next pregnancy. The couple planning for next pregnancy. So what they need to do? The answer is compulsory they need to go for genetic counseling. Then the organ of digestive system most sorry for my mistake. So cystic fibrosis, cystic fibrosis, thalassemia, hemophilia, these three are congenital hereditary disorders, but cystitis is not a hereditary disorder. So this is the infection. Cystitis actually is the infection. I confused with the cystitis and cystic fibrosis. So this is cystitis is an infection and this cystic fibrosis is a hereditary disorder. So here, so that's why this question also once you look here the child has the cystic fibrosis. So this is a hereditary disorder, and so for next pregnancy the couple planning. So for that purpose compulsory they need to go for the genetic counseling. The next the organ of digestive system most commonly involved in the cystic fibrosis, pancreas. Then here you can see the name of cystic fibrosis derived from characteristic histologic changes in pancreas. Then that's why it is called fibrocystic disease. Actually this cystic fibrosis mainly affect the one digestive organ, and that organ is pancreas. So that's why this cystic fibrosis is also called fibrocystic disease. Then salty taste felt while kissing the child occurring. Salty taste felt while kissing the child occurring which condition? The answer is cystic fibrosis. Why? Because here you can see infant taste salty in cystic fibrosis when kissing due to excessive chloride in secretion in sweat. So it gives positive set chloride taste. Then next, developmental change that occurs all the stage of life is known as. Developmental change that occurs all stages of life is known as life cycle approach. Life cycle approach is nothing but it is a development change that occurs all the stages of life is occurs all stages of life. Then next, children generally double their birth weight by 5 months of age. This is an example of children generally double their birth weight by 5 months of age. This is an example of physical growth. How much sweat is needed for test of analyzing cystic fibrosis in child? The answer is more than 75 mg per deciliter. Then next question. Knowledge of normal growth and development of child is essential for the nurse because knowledge of normal growth and development of child is essential for nurse because. So as a nurse, compulsory we should have the knowledge of normal growth and development because it is basic to understand the sick child. Then the importance of healthcare providers to monitor the growth and development of children. The importance of healthcare provider to monitor the growth and development of children. The answer is early detection of potential problem lead to earlier care and treatment. So why as a healthcare provider we need to monitor growth and development of children? So when we are checking growth and development of children, automatically we can find out is there any problem in children and we will go for treatment. Then next, knowledge of growth and development of children is essential for the nurse because. Okay. So already repeated question. Okay, so let's see next question. Okay, the next, prenatal period of growth consists of. Prenatal period of growth consists of ovum, embryo and fetus. The next, a neonat period means. A neonat period means 0 to 28 days or first 4 weeks of life. 1 week contains 7 days and 4 weeks is nothing but 7 4s are 28 days. Right. The next question, prenatal period is from 0 to 14 days. Then embryo period is 14 days or 2 weeks to 8 weeks. Okay, then next question, toddler means or the age of toddler is. Just you can give the answer in my comment box. Thank you.